Hello everyone, my name is Pega and today I will give a presentation for our paper with the title of Scribe, Improving Older Adults' Access to Medical Instructions from Patient-Physician Conversations. In general, patient-physician conversations contain critical medical instructions that can be difficult to recall at a later time, especially among older adults who manage multiple chronic illnesses and may encounter accessibility challenges such as difficulty hearing. Existing interventions to aid recall of medical advice at a later time include audio recordings, cognitive methods and rehearsal, as well as electronic health records. Audio recordings can provide access to detailed information, but they contain verbatim conversations which can make them inefficient to revisit and navigate. Cognitive methods simplify language, and rehearsal involves asking patients to repeat the information, but both of these methods are applied during or right after the visit and are not available once the session ends. Electronic health records can provide access to doctors' notes. However, online portals introduce certain barriers for older adults due to limited digital literacy or usability issues. More recently, interactive note-taking tools such as EmpowerMD have been developed for doctors to create notes and document patients' data based on patient-physician conversations. However, no literature discusses the implication of these tools for patients. Therefore, to help older adults better access and organize medical advice, we developed a prototype called a Scribe that provides patients with the information shared during doctor's visit. Here I display an example of a Scribe that shows how an older patient is navigating through some parts of the prototype. So as you see, the user first signs in and then is presented with a list of doctors. The user selects a doctor and it shows them all their visits. To see the conversation, the user selects the full conversation associated with a specific visit. Users can also see an outline of doctor's words by selecting Check Outline. So as you saw, some features of a Scribe include having access to the dates and times of visits for each doctor, as well as having access to notes generated based on patient-physician conversation and being able to set reminders. When selecting doctor's notes, patient can have access to the full conversations, a summary of doctor's words, and an outline in which doctor's words are classified into different categories such as history, medication, and plan. In addition, patients can set reminders about the specific medications they have to take and the time, as well as future appointments. We then conducted a user study to better understand older patients' current experiences visiting their doctors, as well as evaluating users' acceptance and perceived usefulness of using a Scribe to collect and organize medical information provided during their visits. We recruited 10 older patients. The study was conducted remotely for a total of 30 to 45 minutes. We defined 3 scenarios and 5 tasks. Examples of scenarios and tasks were reviewing the notes from a specific previous visits, and the task was recording the conversation or reviewing the outline. After the last session, we asked participants to complete the Technology Acceptance Model TAM questionnaire, which is a survey to gauge perceived usefulness and perceived use of a technology. And then we asked participants a set of interview questions. The questions were focused on situations that the tool could be useful, advantages and disadvantages of the tool versus participants' current ways of managing information received from doctors' visit, and how the tool might influence their relationship with formal and informal caregivers. The results of TAM analysis shows that overall participants agreed that Scribe is easy to use. Only 10% of participants slightly agreed that interacting with Scribe would be flexible and it would be easy to get Scribe to do what they wanted to do. In addition, 20% of participants slightly agreed that they would find Scribe easy to use. Similarly, most participants agreed that Scribe is useful. In this case, 30% slightly agreed that using Scribe would increase their productivity, and only 10% slightly agreed that they would find Scribe useful. We then performed thematic analysis from participants' responses to interview questions. A theme that emerged was initial thoughts about Scribe. Participants mentioned that the tool allows easy access to medical conversations after their visits. For instance, one participant commented, "It is a device that helps me to keep cheap track of my doctor's appointments and what happened during the appointments and medications that I need to take." Another theme was enhanced reorganization and navigation of Scribe with respect to online portals and paper notes. For example, one participant said, "Everything is in one place, but with my chart, a type of patient portal, every hospital has its own network, and you have to use a different system for each." The third theme was supporting recall. Users specified that Scribe can improve recall by setting reminders and reviewing doctor's notes. One participant commented, "The reminder is the main advantage. It is like having a friend to tell you that it is the time for this medicine, or tomorrow you have an appointment at this time, especially for elderly who live alone." Another theme was supporting older patients with various disabilities such as hearing impairments and low vision. For example, one participant said, "Usually when I go to doctor, due to my hearing impairment, it is difficult for me to understand all the information and I have to ask the doctor to repeat. But with this application, I can record the conversation, and after that, if I didn't understand something, I can come back home and read the information." Another theme was supporting relationships with caregivers. Participants mentioned that Scribe can enhance communication with family caregivers and help them to be more independent. In addition, it can save time and enable trust with formal caregivers. For example, one participant commented, "It is useful to review and show to family members what the visit was about. If they ask questions and you can't answer, you can show them the transcript. And maybe after reviewing the transcript, we might understand that I forgot to ask a question from the doctor." Another participant said, "You are more ready to ask questions in your upcoming visits with your doctor. Also, it would make the communication with your doctor more clear because you know what you want to ask or what has been talked about." So to conclude, older patients face challenges gathering, recalling, and organizing medical advice shared during their doctor's visit. In this paper, we introduce a Scribe that allows older patients to have direct access to medical instruction based on their conversation with their doctors. Our findings show that overall participants had a positive opinion about Scribe and mentioned that Scribe enhanced recall and navigation of medical advice as well as improving the relationship with both formal and informal caregivers. Based on our findings, future work suggests adding other features such as question answering, in which patients can ask more detailed questions about their medication or symptoms. In addition, more research needs to be done to ensure the accuracy of the transcript as well as preserving privacy and data access. In the future, we will also involve other stakeholders to better understand the implication of similar tools on their work and relationships with patients. Thank you.